I'm Dr. Geetanjali Dambalkar, practicing at my clinic by the name of Gurgaon Child and Vaccination Clinic at Sector 66 in Gurgaon. Today I want to talk about a few of the common situations which I encounter in my clinical practice. ज़्यादा common question मुझसे पूछे जाते हैं, उन्हीं को मैं आज cover करना चाहूँगी related to child health. So very often in my clinic I see parents who come to me and they want to know about what they can feed their infant, what are the food items that they can give to their child who's about 1 year old now. So let's start with the most basic things. So speaking of breast milk, we all know breast milk is very important for a child. It is the only thing that you can give to your child under 6 months of age. So ideally the breast milk has to be continued right from the birth up to the age of 2 years. The reason for that is the child's brain grows rapidly, and it is the most developing period for a child's brain up to the age of 2 years. That's why we suggest that breast milk should be continued up to the age of 2 years. As the child grows, like when the child crosses the age of 6 months, then it becomes more important to supplement the breast milk with additional sources. At that point of time, the breast milk is not the thing which will satisfy all the nutritional needs of a child. That's why we suggest to start the complementary feeding. So since we are talking about a child who's now 1 year of age and has come to the clinic and the parents want to know what all they can feed the child. So in addition to continuing breast milk, which is recommended, there are a few other things that we should include in the diet. Like a 1 year old child can eat everything that is cooked and prepared at home, except for a few minor changes. Like we would prefer that the food that is being given to an infant should be devoid of spices and should not be too high in salt or sugar content. So with those minor variations, the child of 1 year age can eat pretty much everything which is cooked in that household. So like whatever the parents are eating for breakfast, let's suppose it's a upma or a dosa or a poha, everything can be fed to a child, taking care of the spices and the salt content in the amount which is being fed to the child. So like that, in every meal the child should eat as much as possible the diet or the food which is prepared at home. So in that manner, we have to give at least 4 to 5 feeds to a child, because at one go, obviously the child can't eat everything or a large quantity. So we usually prefer to give them like 3 main meals and in between a few snacks. Now, what can we give as a snack? Again, you can offer fruits. The locally available, the seasonal fruits, whichever are there, should all be offered to a child, and a child should also be encouraged to eat them. And one very common situation I encounter is that parents say a lot of times that my child is not eating the fruits or the food which we are making at home. So my question to most of them is that, are you eating with the child? Is the child being included in the meal time with the family? So a child learns eating from what the parents are eating. So generally it is noted that the acceptability of the food is better when the child is eating alongside sitting with the family. So that is something we encourage. And in addition to this, I have also noted parents who tell me that their kids are fussy eaters. So for them, we do encourage, like, you have to introduce only one new food per week, 1 to 2 new foods per week, because children are generally predisposed differently towards new tastes. They're not inclined to eating new tastes. So in that case, we just incorporate 1 new item or 2 new items per week at the most. So that is the ideal feeding pattern for a child who's say 1 to 2 years of age. The other thing which I have often encountered, many parents ask me, ma'am, do you think we will need any nutritional supplements for the child? What are the nutritional supplements? So the thing is that if a child is eating most of the home-based food and is also eating the fruits and vegetables, pretty much everything of his nutritional requirement is being met. So you do not need to give him any additional supplements. All you need to do is just focus on the regular diet. That is all we want to do. Many parents do also ask about milk, that bachcha upar ka doodh nahi pita, we don't know what milk we can feed him. So the milk, yes, even if the breast milk is being fed, at least if the breast milk is being fed and the child is not taking top milk, that is fine. But if you're looking at reducing the breast milk for the child, if the mother is working, or wherever the case may be that the child may not have access to breast milk, so in that case we do recommend top feeds in the form of milk, and beyond the age of 1 year you can give animal milk like cow milk. So what milk is preferred? So generally under the age of 2 years we would suggest a whole milk or a full fat milk. And once the child crosses the 2-year mark, depending on the nutritional status of the child, you can shift to a skimmed or a toned milk. So that's about the milk part. A lot of times parents say that बच्चा खाना खाता ही नहीं है, उसे भूख ही नहीं लगती है. So it's like the appetite is low. So what do we do in that case? So most of these situations I have noted that are just parents' observations. So this needs to be confirmed. You visit a doctor, you must check the height, and you must get the weight and the height of the child checked, and the development of the child be tracked over time. So that's why it is best to get, when you find that the appetite is reduced or the child is not eating up to the mark, it's best to get that ascertained with the doctor, because a lot of times the cause of such a reduced appetite needs to be ascertained, which can best be done by a physician or a pediatrician. So best to take to a doctor. There might also be a nutritional deficiency which might be causing the low or the reduced appetite. So once the cause is detected, we can treat the same accordingly. Thank you everyone. These are the few tips on feeding in case of young children I wanted to give today.